Hi, Rhea.
Hey, Isabel.
Thanks so much for joining me. It's really great to sit down with you finally. We've talked a little bit before via email and on the phone, and you've worked within the New South Wales workers' compensation system for a long time and have seen it from the coalface, especially through periods of change. But before we start, maybe do you want to introduce yourself a little bit?
Yeah, totally. I can actually boast that I am one of the 200 or 320 plus year ESSA members. So been in the industry as an exercise physiologist for about 21 years now. So I am a child prodigy. Look, I think I landed in workers' compensation. Nobody, I think, goes out and says, oh, I'm going to go and do workers' compensation when they come out of industry, but then completely fell in love with it. So as you said, I started as a clinical exercise physiologist within workers' comp and then moved into the occupational rehab space. And now kind of in this middle stage of my career, I'm doing a lot of policy and advocacy and working across Pacer Care and a couple of other places as well. So some T&D.
Yeah, I've seen a lot of you online. You have a great presence, so it's really good. Just for those who are listening, I'm Isabel King and I'm a Policy and Advocacy Advisor for ESSA, Exercise and Sports Science Australia. And we just came here today to talk a little bit about the New South Wales workers' compensation reform, what's going on, what it means for our members and where we can go from here.
Yeah. I think it's fun that I get to come out to Brisbane to talk about workers' comp New South Wales.
I was ready to hop on the plane.
Thanks for having me out.
Awesome. So with the New South Wales reforms now on the way, there's been a lot of noise and a lot of uncertainty and plenty of questions from our members. So today I'm really keen to unpack those changes and what matters most for exercise physiologists and what this means in practice and not just on paper. Yeah. There's a lot of paper circulating and like the report just came out last week and the bill has passed, all those things. From where you sit in the scheme, what wasn't working in the scheme in New South Wales and why did change become unavoidable, in your opinion?
Yeah, look, I think anybody who works in the workers' compensation scheme, there's a lot of talk about costs. Right? We are working in effectively an insurance scheme. So we have to remember that there are costs associated to this, and it is being funded. So I'm going to take a bit of a general overview of New South Wales workers' compensation. It is legislation, and what we normally refer to as insurers, so people like GIO and Allianz and EML, they're actually scheme agents. So they only manage the claims management. They don't underwrite it. It's not like car insurance. And just like with any business, profits and costs are something that you need to be mindful of. And I think sometimes we often forget, because in healthcare we like to be really altruistic and we're always worried about money and cost, but that's just the nature of the industry that we work in. So what happened was, over the many years, it got into a massive deficit. So it was actually costing billions of dollars to run the workers' compensation system, which means that if you continue down that way, it would just go into the red and basically the scheme would go broke. And then over recent years, we've had an increase in psychological claims. They've increased by about 64% over the recent years. And then during the 2023-24 period, there was something like 11,000 psychological injury claims put in. And that's just a huge cost. So when we think about costs specifically, a psychological claim can cost anywhere between $146,000 to about $288,000, which is massive, right? Now, what people often forget is that employers pay for this scheme. So me as a small business owner, I pay workers' compensation insurance. To our members out there who have small businesses, which majority of us actually do have small businesses as EPs, you're paying workers' compensation premiums.
Yep.
The change was needed to keep the scheme sustainable. It's about sustainability. And a part of that is, yes, cost efficiency.
Yeah, I think we often forget about that sustainability, that we can't just take out of a system and keep taking out and then there's nothing left and what are we going to do about it?
It's not endless amounts of money. Like, it has to be paid for somehow.
So if you had to summarise the New South Wales reforms in a few headline changes, what's actually different now and what does that mean on the ground for injured workers and providers alike?
There are about 10 different changes in the scheme, in the reforms, and feel free to download it and read it yourself. I had a friend who actually was watching it, the whole thing live, and she just spent like hours and hours and hours doing that. But I think where the main changes are is, again, about scheme efficiency, about scheme sustainability, but specifically for members of ESSA, the biggest change that's going to impact you is going to be medical and treatment entitlements, and going to be the return to work and the prevention focus. Now, there are other things about redefining psychological injury, and that's probably one of the largest changes on there is how they define psychological injury. Weekly benefits and durations, whole person impairment changes, and that's what a lot of the media spoke about. Right, that's where the big kerfuffle was. Whole person impairment is rising. They're having to prove that you're, I think it's 30%, something like that. But for the purposes of this and for ESSA members who are on the ground at the coalface treating patients every single day, the most important things we need to consider now are the medical treatments and the return to work and prevention focus.
So a lot of this sounds less about clinical skills, more about like understanding how the scheme works and how it makes decisions, like good scheme literacy. Let's call it scheme literacy. And from your perspective, what's the difference between being a good clinician and being a scheme literate in New South Wales?
Yeah, so Isabel, I think we want to be really clear here. I want to kind of put it out there that it's not a conversation about being a good clinician or being a bad clinician.
It's about scheme literate.
It's about scheme literate. Less. Yes, exactly. So we're looking at two things here. We're looking at ourselves as a clinician who works within your practice, right? Treating your patients, whether they be NDIS, whether they be workers' compensation, private patients, Medicare patients. You as a clinician are going to do the evidence-based thing. And that's what makes you a good clinician. But what makes you a good clinician within the workers' compensation scheme is understanding the rules of the game, understanding how to navigate your way through the system. So what's changed? Well, it doesn't really change. The reforms haven't really changed being a good clinician. You still do the thing, but it's not the quality. It's about the system that you're practicing inside.
So understanding the system.
Know
how to navigate the system. Know what the system wants to see and all those things, right?
Exactly. Just the way that you've learned how to navigate the Medicare system.
Yeah, correct.
You've learned how to navigate the NDIS system. Learning how to navigate the workers' compensation system is exactly the same, right? So being a good clinician, it's still evidence-based. It's still all of those things. It's still about caring for your patients. It's still about outcomes, giving them dignity, and helping them to recover or move on with their lives, right? None of that has changed. So really want to be clear. None of that has changed. Be good clinicians, evidence-based clinicians. But what's happening in the system, when you are working with the system, is that it's now faster, it's now tighter, and it's more forensic. So we want to change the language to evidence. And it's going to be a bit of a reframe in their minds, Isabel, because when we think about evidence, we think about clinical research and things like that. In the scheme of workers' compensation, evidence is evidence for liability decisions, evidence for approval decisions. And so the clinical care and the scheme decision-making are not sequential. These things run parallel with one another. Right?
That sounds already complex enough.
We'll dive into it, right? And so to be scheme literate, what does it actually mean? It actually means that you understand how your own clinical decisions are made, your treatment plans and your reports, but then you also understand how they're interpreted within the compensation framework.
That's a big one, isn't it? Like how to interpret the outcome measures and how to communicate those, right?
Correct, yes. So a really great example that we see is you can tell me that somebody's got 110 degrees of flexion in their shoulder, but the workers' compensation system is looking at how does that translate into being over the shoulder work.
So big one, translating your outcome measures into a workers' compensation friendly message that is understood within the workplace.
Yeah, if you want to put it even simpler than that is, what do you see clinically? How does it translate functionally?
Yeah, excellent.
And if you simply change that language in your reports, then you're going to be more justified. Because when you look at certificates of capacity, they're not asking what is somebody's degree of flexion or extension. They're asking, can they lift, push, pull, and at what levels?
Yeah,
just tweaking your language. So we're looking about mindset.
Yeah,
mindset's a big one.
So we touched on liability before. So how does a 42-day liability decision fundamentally change the risk and responsibility for treating providers?
Yeah, so one of the changes for the reforms is that psychological conditions are now going to have like a 42-day liability decision. And there's this thing called provisional liability. So within provisional liability, people can access medical treatments.
Okay.
And whether that's you or psychologist or physio, whoever it might be. They can also access entitlements. And when we talk about entitlement, it's weekly benefits and what they get paid. And it's up to a certain threshold. I'm not going to quote that because that's for the policy people and read it in the reforms. But effectively, the reforms don't remove the provisional liability, right? A really good example of this is you're at work, you get hurt. From that day, you have provisional liability by lodging a claim, which means that if you need to have surgery, if you need to go to the doctor, go to EP, go to physio, you can access all of those things.
Yeah.
It's still possible within the system, right?
Okay.
And we've got the approval, non-approval thing. That's the minutiae. I won't go into that. But effectively, someone has ability to access medical treatments reasonable. But because now there's a tighter window at 42 days, what you have to remember as an EP or as a treating practitioner is that if they decline the case at 42 days, then your treatments will cease immediately.
Oh, wow.
If they approve it, then you can continue with your treatments. So where the mindset shift there for any practicing EP or clinician is that if someone's seeing you very early in their stages, you need to be very clear about expectations and obligations.
Yeah.
You need to almost assume, and not pessimistically, but like almost intelligently, you want to be intelligently optimistic about things. But you need to have a setup where if something happens in 42 days and they get declined in liability, you've got a plan for this person who still needs treatment.
Yeah, that's a good
Yeah.
point.
And what I'm going to touch on here is we're not denying that someone has an injury. That's not the thing here. We're looking at who is liable for the injury.
Yeah.
Right? If someone's broken their leg, it's not like they magically no longer have a broken leg because their claim's been accepted or declined. Right? They still have that broken leg.
But
so
who
it's not
takes liability?
It's about liability decisions.
Yeah.
That's the most important thing. So when you're writing treatment plans, when you're writing reports, this is all evidence to support liability or approvals.
So we've been talking about a few tighter definitions in the psychological injury. So how do the tighter definitions of compensable psychological injury change the way EPs need to frame, justify, communicate their clinical reasoning within the workers' compensation?
Yeah, look, I think going back to clinical, you're going to treat that diagnosis in the way you'd normally treat that diagnosis. Yeah. That doesn't change. What changes is your timeline to be able to do that. Yeah. So your assessments need to be quicker. Your decisions need to be more evidence-based. And then you need to change that scheme language. Right, you need to tune that scheme language from how is what you're doing in clinic going to improve their functional capacity.
How do you reckon it would be the easiest, or what would be one tip from you to our members on how to change or how to improve my scheme literacy in terms of language?
The easiest tip I've got for you, for anyone out there, is look at the work cover medical certificate. Look at page 2. And page 2 says, what is this person's work capacity? Do they have no capacity for employment? Do they have some capacity for work? Or are they fit for pre-injury duties? In your own mind, pick one of those as a starter. Underneath that, then you have the actual functional capacity, lifting, carrying ability, pushing, pulling, sitting, standing, driving, right? So bending, twisting, squatting. Stick to those. Yeah. If you want to be really good in compo, you want to thrive in compensation, if you get a copy of that medical certificate and it says lifting 2 kilograms, it says pushing, pulling 2 kilograms, if you do nothing else in your 8 sessions except for increase and improve that lifting, pushing and carrying capacity, you'll be successful within workers' compensation.
Excellent. So
that
learn
is
the
scheme
language,
literacy.
The language to be heard.
Yeah, but what insurers tend to see is the maintenance phase. It's the clinical language of we want them to be able to, lift with a neutral spinal posture, all the clinical stuff. That's important. I'm not saying that's not important, right? But when it comes to scheme literacy and translating that, not that we don't care, but we don't really, it's not important in the grand scheme of the workers' compensation scheme.
Yeah.
Right. But I'm going to touch on psychosocial.
Yeah, go for it.
Because we're talking about return to work.
Yeah.
Now, I've got a case recently and he's got a shoulder injury and he loves to go fishing.
Mm-hmm.
Can't go fishing because he can't cast a rod, which also means at work he can't do any push-pull above the shoulder. You can buddy those two things together. And there's a part of that, there's a part of your AHTR that allows you to do that. Is I'm going to improve overhead reaching clinically to be able to work overhead and also to be able to go and do beach fishing.
Yeah.
We call it bundling goals. So anyone who's done any of my courses on this, it's called bundling goals. The other big tip I'm going to give you is this thing, we call it consistently creeping capacity. Anybody who knows me knows that I love alliteration. Right?
I like it.
So consistently creeping capacity. Your 8-session treatment plan, if you know it's going to be another 2, 3, 4 months, because, science, right, when it comes to injury recovery, creep the capacity.
Yep.
In that first AHTR, don't say you're going to go from 5 to 20 kilos because you're not a hero.
Yeah.
You're not going to change science. Yeah. No one, it's not possible. But you're also setting your patient up to fail.
Yeah.
And you're setting your treatments up to fail. So the way that we want to mindset shift it is if you go from 1 kilo to 2 kilo, you've improved somebody by 100%.
It's often underestimated, isn't it? The tiny little improvements count.
And consistently.
Yep.
Right? So over an 8-session treatment plan, you're going from 1 to 2 and maybe increasing a couple of hours. That's great. We want to see that.
Perfect.
That's how you get literate within the scheme.
Excellent. Well, that was great insight. Thanks for that.
Well, that's what we're here for, right? Little tips.
Alrighty. Now focus on early intervention and work capacity. How can exercise physiologists and ESSA members clearly demonstrate their value and avoid being sidelined? Because I think that's a bit of the worry of some of our members maybe, that EPs do not get the recognition. Where do you see?
Where do I see that?
Yeah.
I've already got 10 minutes.
How can we better demonstrate our value to the scheme? It's a tricky question because I think many want to see that economic value, which is something we have to push for and have the data collection in a different way than it currently is.
Yeah.
However, is there in the meantime a way to better demonstrate the value of our profession?
Yes, and the way you do that is, again, you've got to understand the system, the scheme literacy.
Always comes back to
that. So in the New South Wales workers' compensation system, the most expensive part of a claim is what we call the weekly benefits. And weekly benefits, if someone's off work or reduced work, they're actually getting paid some of their wages, right? Either at 80% or at 95% of what they call their PAWI, which is the pre-injury average weekly earnings. I won't go into that too much, but if you can reduce that. So, for instance, if someone's getting paid $1,000 a week because they're off work, if you can get the capacity up high enough that they go back to work even 2 hours a day, then you've actually reduced the weekly benefits. You've reduced the cost already.
Yeah.
And so, again, it goes back to the scheme literacy.
Yeah.
If you can prove through your evidence and through your clinical work, you can actually say, this person can now go back to suitable duties and here is the capacity. Then you're already reducing costs. So think that where your mindset needs to change to is, where is this clinical function then translating into functional capacity for a work thing, for work. And if you can show that and you get that person from no capacity to work, and you remember the boxes that I spoke about? If you can shift from one box to the next box and you've shown that within a treatment plan, that's your value. I will refer to you as a rehab consultant. I will encourage every doctor. I will talk you up all day long to the claims manager. Yeah. Right. Now, speaking of claims managers.
Next one.
The next one is
tricky one, yes.
The best value you can give and you can show is by talking to somebody. Mm-hmm. All right.
Speaking of.
Am I leading you into the next one?
You
Do you want to go ahead?
Claims manager. We often have that. Claims managers, we don't speak to claims managers. We haven't heard from claims managers, or we have not been referred to by claims managers. What's your thoughts there?
Claims managers are humans too. I've had the absolute immense privilege to be able to speak not just in my daily work as a rehab consultant, but also to actually work really closely with case managers and claims managers across the country.
Excellent.
And I've done most jobs within workers' comp. And a claims manager job is probably the one that I would never want to do. It is hard. It is a really difficult job. And remembering that these claims managers, they don't have an allied health background.
Yeah.
Right?
And that might make it a bit hard to understand for allied health professions if they're not referred to by a claims manager who doesn't have an allied health background.
That's right. And that's why it's incumbent upon us to make sure that we tune our language and we tune our reports to meet the needs of the scheme. Going back to the shoulder, right? If you write 110 degrees of flexion, you shouldn't expect a case manager to know what that means.
Yeah.
Because it's not their job.
Okay.
Right.
I think there's a lot of expectations towards claims managers.
They
might have to be revisited, kind of.
Yeah. Well, at the same time, you have to remember, imagine this. Imagine this, right, Isabel? Every decision that you make gets scrutinized. Every report that you write could end up in litigation. Every phone call you make is being recorded and then listened to by performance coaches, possibly go into litigation later. Now, imagine just sitting there and then having 200 requests to come through, and every one of the requests you have to put up against some sort of regulation, right? So they have a set of policy and rules that they need to follow as well. Our job is to help them to make decisions. And how best can we help make decisions right in a language that they understand?
Yeah. And talk to them, as you said before.
And talk to them. The value of rapport is huge. And I'm going to give a personal example here. I've been in Compo for 21 years and I've built some decades-long relationships. And to a point where if you do good work, as I said, rehab consultants, we're governed by evidence-based rehab, believe it or not. Like we have our healthy benefits of good work. We've got our pace of care policy and things like that. When a case manager gets to know me, I can make a phone call and say, these are my recommendations. And because we have this history, we have this rapport, we have this trust, they're just going to say, yep, Rhea, I've seen your work. You're scheme literate.
Yeah.
I know you're doing great work as a rehab consultant. They're going to approve that.
It is a form of relationship building.
Yeah.
That's definitely, that's a good point. I think it's often, we see it sometimes so isolated that claims managers, they don't know anything, or like, maybe that's a bit harsh, but,
that's the language
sometimes
that we're
the
hearing.
perception is claims managers don't refer to EPs because they do not have an EP background. But if you, as you say, if we or if our members or anyone who works in the workers' compensation scheme just approaches this with a bit of a different mindset and in a different language and more collaborative and more focused on relationship building as part of their business.
That's right.
Then that will be probably a good successor.
And maybe you're educating them as well.
Yeah.
Right? They're getting reports left, right and centre.
Yeah.
You're not the only person that's asking for something. That part of relationship building is also the education piece.
Yeah.
This is your opportunity when you're speaking with them to, number one, to be curious and not furious.
Yeah.
Teach them about your world and the value that you bring.
Yeah.
But also to learn about their world. How are decisions being made? So we're looking at hot tips and hot takes. Is if you've got a AHTR that's been questioned or scrutinised, the question you ask is, what's going to help you make a decision to approve this? And they're probably going to tell you exactly what it is. They're going to say, it's not focused towards functional capacity. They're going to give you the answer. Yeah. Then you've banked that for the next time that you're writing a treatment plan, for the next worker that you're helping. So you have to look at it as this reciprocal relationship that you have. Now, yes, the claims industry at one stage did have a 20% turnover. It's like a revolving door because the job is so hard. Yeah. But that's not to say that you can't build relationships with the people that you're working with at that moment in time for that specific case. If you're going to do bang for buck, value for money, and people say, oh, we don't get paid for it, whatever, call the case manager.
Yep.
Like, get it on file that you've tried to call them.
That's a good one, yeah.
From the very beginning. Because if you submit an AHTR and they don't know who you are...
Yeah. You're not going to get anywhere.
Yeah, you're not going to get anywhere. But if you call them and say, I'm going to ask for 8 sessions, this is what's going to happen, I'm going to pull you in, they're going to trust you straight away.
Excellent. Right. I think that's a very valuable tip, actually.
Yeah.
So if you're an exercise physiologist, which you are, working in the workers' compensation scheme in New South Wales, in 2026, what's the one mindset shift you need to make to thrive under these reforms, and how do you succeed, just to have this as a final summary of today?
The zinger.
Yeah.
Full disclosure, I haven't worked on the tools in about 10 years, but in saying that, I've had a lot of insight from other EPs and how they navigated the system. But I think let's go back to where we started, which is the good clinician piece. Yeah. So a really good clinician will naturally ask, what does this patient need to recover? But a scheme literate clinician also asks, how will this treatment be assessed? How will it be funded or challenged within the workers' compensation system? Yeah. Right. The other part of that is going back to what does this person need to recover? If they're telling you that they need help mowing the lawns, if they're telling you that they can't clean the bathroom floors, you are in a beautiful position to add value by calling the case manager and saying they need help with these things, because the system is designed to then have other services that fill in for that person. Yeah. And that's going to help your treatment plan in the end, because it's the psychosocial factors that dominate return to work and recovery.
Yeah.
So the thing there is, keep doing what you're doing as a great, good clinician in practice, but overlay that with scheme knowledge and literacy around how the scheme actually works. Clinical findings translated to functional capacity.
Excellent.
And you should be writing this side in your AHTRs, writing this side in your SOAP notes.
Perfect. Right. Be curious, not furious.
Right? Be curious, not furious. And call your case managers and your rehab consultants. We can help.
Excellent. It was really wonderful to talk to you today, and I think our members got a lot out of it, I hope. There's a few tips, and we just hope it lands well. And if there are any questions, please feel free to reach out to ESSA or to Rhea, or if you have any further questions you'd like to be answered, if you're curious about something, how you can improve your scheme literacy.
Yep.
Thanks so much for today.
Thanks for having me.
This has been brought to you by Exercise and Sports Science Australia in collaboration with 3 Sticks Productions, Rhea Mercado HQ, and the Intelligent Rebellion.